Hello, everyone. This is that time of the week, and I'm glad a lot of you have sent a lot of question and all this thing, and I'm hoping to do it once a week. So this week question was really, really interesting, though it looks like it is simple, but it is pretty loaded question. So just bear with me. It might be a long video. I don't know how long it's going to take me, but I'm hoping this is going to be very, very helpful. Uh, so it does not matter where you are watching this, on what platform, Facebook Live, or maybe YouTube, or whatever. Um, the question today was, which I've been asked multiple times, and it seems like this is a good question to answer. And I'm going to tell you why it is so important. The question was that why I feel like I have to pee or I have a leakage when I sneeze. Well, basically, what you are talking about incontinence issues. Now, what is incontinence? By definition, incontinence is partial or full loss of control of bladder or bowel movement. So it could be partial or complete. So the many reasons are there. So I'm not going to cover that. Like, for example, if somebody has a neurological disorder, yes, you can lose completely a bladder and bowel control. I'm not talking about that because that is not that common. It can happen, but it is not common. And second thing, again, incontinence in male, but then that is not common. That can happen because somebody had a prostate surgery or they have cancer, they have radiation. It talks about other kind of health issues in male. So basically what I'm going to focus, which is extremely common, and all of them are women. That is exactly what the problem is. In fact, if you're a woman above the age of 40, but I'm putting an age just to give you a landmark, but it has nothing to do with the age. I'm going to talk about that in a minute. So above the age of 40, you will have some kind of bladder or bowel issues. Now, what does that mean? So in our clinic, if you are our past patient, you are watching, you probably already know. If you are not familiar with us, then I'm going to tell you, 97% of in our clinic, we treat are women between the age of 35, 40 or 65, 70, something like that, between that age group. And you can give and take a little bit here and there. So that's what we treat here. Many of them, they will come, and they will come here for whatever reason. Usually, most of them, they will complain of pain. They will complain of back pain, or or a hip pain or something like that. So to every one of them, I ask them one question. I say, hey, do you have any incontinence issues? And they are going to answer such a way. First, they will say, no, I don't have one. Or they will say, well, how did you know? Because I didn't tell to anyone. I don't want to talk about it. So what that is going on, that's exactly what I am going to explain, because many of the people, they feel that way. First thing they feel, if you have incontinence issues, means you might not have all the time. Sometimes you have coughing or sneezing, or you have a cold, then you started leaking, or sometimes you have to go to bathroom. Before you could go, like you're busy doing stuff, you can go without going to a bathroom. But now if you have to go, you go, or you are afraid of drinking water or any kind of liquid. Or if you are driving in freeway going someplace, so if you see rest area like 30 miles away or 40 miles away, you like to stop. You say, oh God, I don't know when I'm going to make it or not, another 30, 40 miles. So this is how the whole issue begins. But if you think that if we have complete loss of control, then it calls the incontinence issue. It does not work that way. It slowly happens. And why it is happening, what it is, I'm trying to explain everything to you, try to do today. So, and the second thing is that people think, well, if I'm getting old, isn't that something happens to everyone? Isn't that my mom used to have, so I should have it? So this kind of thing. So they blame it on the age. So if I'm older, it is supposed to happen. So this is part of my life. And second thing is I have to live with it. Or we try to somehow kind of try to cover it up. We buy some kind of incontinence product like Depends and this kind of stuff to do that. But my whole point is you don't have to do that if we understand the whole issue, what is going on. So if I say incontinence, normally people believe either they have partial loss, partial control, or full control, or bladder bowel. So if that happens, so where is the problem? Is the problem is in your bladder, or the problem is in your rectum because you cannot control your fecal thing? But the answer is completely probably going to surprise you. The problem is neither. Your bladder has no problem, but or your rectum has no problem. Now you might be wondering what the heck is talking about. Yes, this is why I'm telling. Now let's begin with one very important landmark. This is what I'm going to talk about: pelvis. Now I have a skeleton here, and this is a pelvis. So I'm not any forensic scientist or anything like that, but at least I know this is a male pelvis. How do I know? Because the male pelvis, they're pretty narrow, narrower than the female pelvis. So female pelvis by design, it is 1/3 wider. It is important to understand. So female pelvis is wider, 1/3 wider. And second thing is that it moves. Male pelvis usually don't move much, but female pelvis has to move. And all this pelvis design is designed for one thing only. It's designed to facilitate childbirth. So this is why a female pelvis has to be wide and it moves. So anything that wide and move, we call that as unstable. So by design, female pelvis is unstable to begin with. Now, how we kind of keep an unstable structure stable? By adding onto it to stuff. Now think like this, like a tie bridge or a kind of a suspension bridge. So the bridge itself does not have much strength, but it has all this string that goes from bottom to top, pulls from both the sides. That keeps the bridge not only suspended, keeps strong. So that is the same design what we have in the pelvis. So it is wide and it moves. So keep everything together. We have kind of intrawoven muscles, and these are extremely strong muscles, and they kind of make it, keep it the pelvis together, yet they make something here. We call that as a pelvic basket. So the pelvic basket holds on everything on the pelvis. So in women, the pelvic basket is extremely important. Well, we might say because of childbirth. And the childbirth is the most miracle and the most amazing process that can happen in a human life. Because imagine a pea-sized uterus is going to grow to carry 40, 50, 60 pound weight, because the baby weight may be like 7, 8 pound or maybe 10 pound, but there is another thing going to add on. So imagine something is holding on, which was holding on like maybe a pea size, which does not weigh much. Now that has grown to carry 50 pounds. So you can imagine how strong is the pelvic muscle has to be in order to withstand that kind of pressure. And then once that grows, we are not sitting around. A pregnant lady, many of you probably have babies, you move around, you go out for dinner, you walk. So we are doing pretty much everything we are doing. But in the meantime, the pelvic muscles, they are holding everything up. So the pelvic muscles' job is not only keep the pelvis together to support each and every organ, pelvic organ. Like the pelvic organs are your bladder, your uterus, your vagina, your rectum, all these kind of pelvic structures it supports. So without that support, everything falls apart. So when they fall out of the place, because your pelvic muscles are getting weak, so that extreme thing, what we call as a prolapse. And the prolapse is they are not in their place, they are just out of their place. That is called as a prolapse. Now, why these pelvic muscles get weak in the first place? So these muscles, as you know, has a big role in childbirth. So it is very much related to the hormone. So not only the female hormone, estrogen and progesterone, there are other hormones are going on there too. So this hormone plays a big influence on the strength of the pelvic muscles. So if the hormone goes up and down, so you don't have to be old to happen, because I have seen girls like that in their 20s and 30s, they came hormonal imbalances too. And there are few disease conditions where your hormone can get imbalanced, like polycystic ovarian syndrome, endometriosis, all those kind of things can create hormonal imbalances. Or somebody is taking birth control pill early on at a younger age, that can mess up the hormone too. So whatever that is, so the hormone, if it is not balanced, your pelvic muscle gets weak. Okay? So once it gets weak, then the issues are going to begin. Now the pelvic is not actually a one bone. The meaning of pelvis in Greek, it means a basin to hold water. And it basically holds water, because you think about childbirth again, how much water it is holding. And then this is not a single bone. So we have two sides. We have middle here, you have sacrum. Then every side it is made out of three bones. So my whole point is there is a lot more going on in your pelvis. So the pelvic itself can tilt forward, can tilt backward, or one time can rotate. Not only it can rotate, it can slip downward. So the pelvis is not settling in the right way. So when that is not in the right way, the muscles actually have to work hard to keep it together. I'm going to give you another example. You are standing up straight, so your bones and everything are locked, so you can stand up for a long time. Now imagine if I tell you to stand up, bending your knee a little bit. Let's see how long you can stand up. You cannot stand up because your muscle has to work much, much more harder to keep your assumed biomechanical position. So it is not working now because you are bending over. You can barely stand 15 minutes, 20 minutes, maybe half an hour. This is how we used to get punishment back in my school days. So now what I'm saying, like when your pelvis is all twisted, and which can happen, we cannot tell you chicken or the egg. I have seen that can happen, like somebody is a teenage year, or sometimes they can do fine. So their muscles are working hard already. So now, if you get pregnant, so the muscles are going to be pushed to the limit. So you get pregnant again, so it's going to be pushed again to your limit. Now imagine somebody had a hysterectomy. So it can do two things. The hysterectomy, it is going to make it mechanically unstable because they have to cut through all the ligament, which actually helps to keep the pelvis together. Or again, after the hysterectomy, your estrogen level goes down tremendously. It does not matter if you have the ovary left alone or the ovary is taken out. It does not really matter if the ovary is left. So it might take another couple of years, maybe 3 years. If the ovary is taken out, things will happen immediately because the estrogen actually helps to keep all the muscles and everything together, not only pelvic muscle, all over your body. So because of that, your pelvic muscle is getting weak. So my whole point is when your pelvic muscles is getting weak because of some reason or all your pelvic bones are not properly situated, so it cannot give enough support to all your organ. So more you are weak, your pelvic muscles, maybe you will start. So this is why the whole thing start very, very, very slowly. So maybe you have some incontinent tissue after you give birth your first child, because not everyone is same. It can because your fingerprint does not match with anyone. So everyone is individual, and everyone has a separate case. So what really happens? Imagine you have some weakness during your first childbirth, or you have a weakness to begin with after your first child. You got pregnant, then you started having more incontinence issues, and then somehow you got better. Then you have pregnant for the second time. It is going to happen again. So now you hit the perimenopausal age, which is average menopause in US is 52. Well, that is not a single age because it is the whole thing is a process. Once you hit the perimenopausal age, then your hormones started declining. They're bouncing all over the place. So when that happens, obviously your muscles are getting weaker and weaker and weaker. And God forbid, if you had a hysterectomy, then it even pushes you further. So when your muscles are so weak, it cannot support the pelvic organ. So we see many women with the same condition, but it's the same thing. They might complain of painful intercourse because your vagina is not properly supported. Depending where you have the weakness, you have the symptom. Or they might have kind of complain of unexplainable diarrhea or constipation. Or they will complain of urinary incontinence. Because somehow, what I have seen, we are trained from the beginning that everything is separate. And the very reason why all these things are happening, the pelvis is happening, you are experiencing so-called back pain. In women, back pain actually does not happen because your back stops somewhere here, but you have complaint of pain over here. So when you are complaining over here, that is exactly right here. You are complaining of pain right here, right here, but your back stops somewhere over there. So your back pain has to partly to do with your pelvis. So the very reason you are complaining your back pain and you are focusing on pain, you say, yep, I can deal with my incontinence issues. I'm using Depends, this, that, I can survive, but I cannot deal with my pain. So this is how we think everything is disconnected. So your back pain, you probably went to a doctor to treat your back pain, but we think we have all the specialty. Now you have incontinence issues, you go to a urologist. Okay. Now you are having maybe unexplainable diarrhea or constipation. Now you go to a gastroenterology. They are checking what is wrong over there. Now you probably have painful intercourse. You go to OB/GYN. They are looking for infection. But my whole point is everything is related and connected. So you cannot do bits and pieces and hope things are going to get better. So but to treat, it is really simple. First thing, whatever is problem in the pelvis, that has to be taken care of first. That has to be corrected. I do not like to word fix because in our body nothing gets fixed. Everything changes every single day. So it has to be corrected and it has to be maintained. And after we maintaining it, then the solution is really simple. We need only a 99-cent bulb. Well, it probably a little bit more expensive now. Somebody was telling me it cost like $2 or $3 now. I don't know. Whatever that is. It is a simple thing. You can buy it in any place. And that is simple. So if we are running around doing different kind of things, well, the only option is available, or anybody you go, like urologist or whatever, they they're going to give you first the medication, and they have all kind of name, overactive bladder, this, that. Yes, I understand. And these are all names. So they give you medicine just to relax your bladder. Well, it might work for a little bit because your basement, like imagine this is kind of your basement. Okay. Now you built a house on swamp. So no matter how big of a concrete or whatever you put, because the base is not right, the whole thing is going to sink. It is something like that. So if your pelvic muscles are not strong enough, no matter what you do, it is not going to work. I have seen over the years, people went through those bladder tying surgery, or called as a sling surgery, 1, 2, 3, 4, 5 times. But the problem remains the same. They still have the same problem. But you don't know any better, so you go into the urologist. They give you some medication to relax your bladder, but your bladder has not the problem. It is the surrounding area, it's the pelvic muscles. They are the problem. So it might work a little bit. Then if you choose to have surgery, they put a mesh, which is many times you have seen in TV, they are on recall. They put the mesh, and I think that is most barbaric surgery I've ever seen. They put a mesh up there to hold it, but then the bottom is falling off. That is your pelvic muscle. Now you are complaining about more back pain. Now you have other kind of issues. I cannot talk about all those things today, but it can lead to multiple kind of problem. But we are focusing on bladder because that's what we think. Like, if I have back pain, I need to fix my back. I have a bladder issue. But the whole thing is, unless we strengthen the pelvic muscle, nothing is going to work. You probably heard of Kegel. Well, Kegel is a great exercise, and it can be done. But the problem with the Kegel is you need to be first has to be square, what we call your pelvis has to be in the right place. Things, if it is some torsion going on or some tilt going on, it is not going to work. And also the pelvis does not separate, tilt isolatedly. It also affects your upper body as well as lower body. So that could be other influencing factor which is acting upon pelvis. So all those things has to be identified. Then next, your pelvis has to be squared. Then all the strengthening exercises can be done. And after we do all that, so we use something a lot more intensive exercise to strengthen the pelvic muscle, because anybody who walk in through a door, they have incontinence issue or not have incontinence issue, we have a routine to train their pelvic muscle. That is a must. There's a women, I don't care if they're in their 20s, 30s, 40s, 50s, we always do that, because if we start doing it ahead of time, you don't have to wait for a problem to solve it. If we know what the problem which is yet to come, we can actually solve the problem ahead of time. So if we do the exercises, if we can square the pelvis, we don't have to go through all this problem. This is what I preach, I teach. We treat everyone who walk in through the door here. So if you are thinking, well, I'm just getting old, nothing can be done. The oldest one having pelvic issues or they have incontinence issue, I remember I treated, is at least 92 years old. And somehow she got somehow, but because, we think quick result, quick fix. It does not happen when you are strengthening a muscle. Like imagine if you are going to do a gym and you are trying to strengthen, you have to do exercises at least 6 to 8 weeks intense, even if you want to see a little bit result. Now we are treating something very, very indirectly because we do not do the direct treatment of your pelvic muscle. Everything is done indirectly because it is more comfortable and it is more effective. So no invasive or nothing like that. So that can be done. So, but first thing, we need to recognize the problem and we look for help. So without looking for the help, or if we have that, nothing called embarrassing, it is your body. So you have every choice, everything to get better, feel better. Because I know many people, because of the incontinence issue, they will stop going out of the town to see their grandchildren. They say, well, I cannot take that drive. And if I go there, it is pretty embarrassing. I really means people will avoid stuff, but that is not the way to live. So the whole point of the whole therapy or medical facility to improve the quality of life of everyone. So incontinence issue, it might not be not visible, not anybody paying attention, but it is a huge, huge, huge issue. What I have seen over the years, over 30 years, and every woman we see here, they sometimes they don't want to talk about it, but once I tell them from my side, they open up, and then only they realize, yes, this is something to be taken care of. Again, thank you guys for putting up with me, listening to me, and as always, pour in more of your question. I'll try to address as much as I can. I promise you I'll do at least one video every week, no matter what happens, no matter how busy we get. This is kind of a little bit downtime for us, but no matter what happens, I am going to get you informed every week. So pour in more question as always, and we'll try to answer as much as I can. So if you need even more in-depth information, you can sign up any of our webinar. We have those things, or we have workshops here. Now we are not doing in-person workshop, but we have a lot of webinar I do just to get you the understanding, because this is very important. So you need two things to solve any problem. You need first thing know-how or the knowledge. Without your knowledge, you only recycle whatever you know, like thinking like that, yes, I'm getting old, this is how it's supposed to be, nothing can be done. And second thing, you need tool to get over it. And both of these things, I personally doing it for 30 years, because many of you, you are our past patients, they know that how much time we spend on educating. Because more you know, less you are going to get into trouble or get into doing unnecessary stuff. It is really mind-blowing how much unnecessary stuff getting done. But the solutions are really, really simple. Okay, so thank you again. And you guys have a wonderful weekend, and I'll see you next week. Bye.